Will new patients solve all your problems? I get asked that all the time, and I always question, where did that come from, that new patients would solve all your problems? After years of being in practice and working with hundreds and hundreds, if not thousands of clients, I've really come to the conclusion that technically, new patients won't solve your problem. Over the years, I've worked with many clients who've been in practice for years, 10 years, 15 years, 20 years, and they've marketed for years for new patients. So there is some truth that new patients do solve your problems. But many times when I talk to clients and I dig deep, I discover that it's not the new patients that are the problem. It's when the new patient arrives in the office that for whatever reason, they don't become a patient that is actually the problem. And because you've all been in practice for such a long time, and you have so many of these people that maybe have come to your office, maybe treated a little, maybe treated a long time, but never actually maybe solved the problem or never actually treated at all. We have this enormous stack of people who have a problem that you can help, that you've already paid for as a new patient, but that are still there. And so the interesting point is, will new patients solve your problem? Yes, they will. But you've already paid for years for new patients. But the next step is really to figure out, how do we get those new patients so that you can help them, which will bring increased income into your practice, which then truly solves your problem. So what I usually say is, new patients, if you've been in business for a while, aren't going to solve your problem. What's going to solve your problem is actually looking at the new patients that you already paid for over the past many years, that responded to your ad, to your Facebook ad, to your TV ad, whatever you did, 100% of the people that responded have a problem that you can solve. Where are they? And that's where your gold sits. What I always say to clients is, before you go buy a new marketing program, before you believe again that new patients are going to solve your problem, learn to dig in your database, because those are your new patients. You've already paid for them. And at AMI, we have a very exact science on how to actually farm your database precisely by condition to be able to reactivate that database. Because one thing I know for certain, they probably haven't solved their problem. That person with low back pain, maybe neck pain, they probably still have it. And they're out there still searching. So they will become your next new patient. So again, the question, does new patients solve your problem? No, farming your database does. The one thing AMI has is a very exact science and sequence of a system that you will carry out, which is going to farm your database and flood your practice with new patients for the next year, and that's going to solve your problem. So click the link below or above or wherever the button is, see if we can help you.